Let's talk about balanced upright posture. So we are going to see how gravity line passing through the human body and which are the things which are making our posture in a correct way. So first, ankle. So the gravity line is anterior to the joint, so it may lead to tend to the tibia rotate forward, so which is prevented by plantar flexor muscles, primarily the soleus muscle. Then the knee. The normal gravity line is anterior to the knee joint, so then it will lead to keep the knee in extension. So stability is provided by ACL, anterior cruciate ligament, and posterior capsule, and hamstring and gastrocnemius muscle. Then soleus is also providing active stability by pulling the tibia posteriorly. So if the knee is fully extended, no muscle support is required to maintain it in upright posture. But if the knee is in slightly flexed state, quadriceps is going to contract and prevent the knee from buckling. So next, hip. So the gravity line at hip varies based on the swaying of body. So if the line passes through the hip joint, there is equilibrium and no external support is necessary. But if the gravitational line shifts to posterior to the joint, some posterior rotation of pelvis occurs, but it is controlled by tension in the hip flexor muscle, which is primarily iliopsoas. So during relaxed standing, the iliofemoral ligament provides passive stability to the joint. No muscle tension is required. Now let's see that if the gravitational line shifts anteriorly, the stability is provided by hip extensor muscle, which is active support given. Then trunk. So normally the gravitational line of the trunk goes through the bodies of lumbar and cervical vertebrae. So the curves are balanced. Some activity in the muscles of trunk and pelvis maintain the balance. So if the trunk shifts or contralateral muscles contract and function as guy wires. So when is inner structures come? Inner structures means ligaments and capsules and others. So when there is an extreme or sustained deviation, support is given by the inert structures. So then head. So the center of gravity of head, which is falls anterior to atlanto-occipital joint. So the posterior cervical muscles contract to keep the head balanced. So there is a tip. So if the gravitational lines goes anterior, posterior muscles, it keeps to maintain it. So it's vice versa. The more the gravitational line and the muscles which is opposite to it, helps to maintain the stability.